The World Health Organization has released its global report on hypertension, which most people in the medical community call the silent killer. Hypertension or high BP is a cardiovascular disease, and each year it affects more than 1 billion people globally. Who among us does not know a person with high BP who's either diagnosed or getting treated? We all do. It is that widely prevalent, and it is deadly if it's unmanaged. Unmanaged hypertension could lead to heart attacks, organ failures, and strokes when uncontrolled. Many studies have indicated that it is the leading cause of deaths worldwide and causes more damage than tobacco and sugar combined. Every year, at least 10 million people die of hypertension that is uncontrolled and untreated. This WHO report looks at global data on hypertension, lessons learned from managing it, including key takeaways from India, and how public health officials should start to manage high BP in various countries going forward to reduce the burden of this disease. The report outlines how this can be done easily with simple and low-cost medication and efforts. There are several key takeaways from this report. First is just some data on hypertension, which is quite scary. Hypertension globally is not a controlled disease. In adults aged 30 to 80 with hypertension, only just over 50% have been diagnosed, only 42% are being treated, and just about 20% have the disease under control. Many countries have large-scale hypertension control programs from which valuable lessons can be learned for management. Globally, except for the Southeast Asian region, most world regions have over a 40% prevalence rate of high BP. Among South Asian countries, India has in fact managed hypertension better than our own neighbors Bhutan and Pakistan, and we'll see soon why. And India also fares better than most places in Africa and South America, as well as Eastern Europe. Biological males are also more susceptible to high BP than women as long as their age is under 50. Above the age of 50, all risk is equal for all genders. Among younger people, Southeast Asian region has a lot of cases having gone up from the numbers in 1990 to 2020. Among the global numbers, we can see that the percentage of treated people is quite low, and it drastically depends, as expected, on the income classification of countries. Among deaths attributed to high BP, the Southeast Asian region is in fact quite high, as is the Western Pacific region. Another takeaway is the outline of how countries should manage hypertension. For this, WHO recommends national leadership, developing countrywide public health programs to address risk factors, establish treatment regimen, and address broader societal factors that can enable healthcare systems to support patient care. The result of this would be a drastic reduction in deaths due to hypertension, improved quality of life, and the report also makes sure to stress greatly reduced economic losses to each country. The report also talks about how hypertension can be managed with a healthy diet, which includes less sodium and healthy levels of potassium along with medication. For hypertension and high BP, it is of course known that a person must reduce salt intake. But the report also stresses that diets that include vegetables high in potassium and nitrates, whole grains, and plenty of fruit lowers blood pressure. For this, WHO recommends not just lowering sodium content in food products, but also conducting media campaigns for awareness, implementing good food policies, and labeling systems on products for customers to make better and more informed choices on sodium content. The report also details a voluntary list of global health targets to achieve in non-communicable diseases that is expected to play a key role in reducing hypertension as well. It includes reducing the harmful use of alcohol and tobacco, increasing general physical activity, reduction in sodium intake, which we just saw, availability of therapy and counseling for drugs, increased availability of basic medical technology to diagnose and treat lifestyle diseases like hypertension, and ultimately the lowering of obesity, diabetes, and hypertension, and thus deaths by cardiovascular disease. Alcohol consumption is eighth among mortality risks, and excessive consumption of alcohol can lead to liver toxicity and increased risk of cancer. This is well known, but a lesser known connection is that between alcohol and heart disease. For this, WHO has already introduced the SAFER program in 2018 that restricts alcohol availability, enforcing drinking and driving measures, increasing screening and treatment, and enforcing bans or restrictions on advertising and raising prices. The other toxin is, of course, tobacco. Tobacco use causes 8.7 million deaths globally every year and definitely leads to cardiovascular diseases. To lower tobacco consumption, WHO implemented back in 2008 the M-Power framework, which monitors tobacco use, protects people from secondhand smoke, helps people quit, warns about the dangers of tobacco, restricts advertising, and suggests raising taxes. A similar framework has also been implemented for increasing physical activity, and it is aptly called ACTIVE. The ACTIVE program develops guidelines for physical activity across ages, raises awareness, and invests in new physical activity technologies for each country that follows the framework. Air pollution is another major risk for non-communicable and cardiovascular disease, and tackling this is highly challenging because of increased emissions. This is already a battle that is being waged across the globe and is being fought against oil corporations and wealthy nations at a global level. The report also makes points on how to tackle hypertension from a public health nationwide perspective. This includes diagnosis and early detection and effective management of hypertension. There are some good examples mentioned in the report of successful programs for hypertension care, and one such program is from India. This is called the India Hypertension Control Initiative, or the IHCI, and it is a collaboration between ICMR, WHO India, the Health Ministry, and the Resolve to Save Lives. It began in 2018 and it used the WHO Hearts Strategy framework for implementation. Currently, it covers 27 states with 155 districts and an estimated population of 5.8 million Indian patients who have been diagnosed with hypertension. In 2 years, the program successfully ensured that more than 70% of healthcare facilities in these regions had at least 1 month's worth of stocks of medicines, along with strengthening their supply chains. The report concludes with details showing evidence of how these simple interventions have worked successfully in multiple countries, not just in India but also Cuba and Philippines and several countries in South America. Perhaps the greatest takeaway was the evidence from India's IHCI program that specialist health consultants for hypertension served a very positive role in increasing awareness and treatment. In India, more than 800 medical officers, 4,500 pharmacists, 9,000 staff nurses, and over 20,000 healthcare workers are trained under the IHCI protocols and provide care to the 5.8 million patients mentioned earlier effectively. And by 2025, India hopes to put 75 million patients with hypertension or diabetes on standard care.